right when I got started at Eisner, I was a brand new pediatrician attending, and I received a newborn. That's usual. That's typical day as a pediatrician. You get a newborn. But this newborn came with a lot of paperwork and a lot of things that the clinic and I had never seen before. So the mother was on methadone, she says, for headaches. And her doctor said that nothing was working and methadone was what she should be on, and she got pregnant. And so her baby was born addicted to methadone. And usually when this happens, I trained in the Bronx. I dealt with a lot of unfortunate, babies born addicted to opiates or other types of illicit substances, and we wean them in the hospital, in the NICU or in the nursery, depending on how sick they are. We spend the time weaning them, actually giving babies morphine and following their withdrawal scores, because withdrawal can be very painful, can be very hard. Like, adults talk about opiate withdrawal, and that's why they relapse so much, because it's so painful. Imagine that in a newborn. They're going through the same things. They're going through the shaking, the sweating, the diarrhea, the irritability, all of the things as well. And that's really hard on a newborn's body. And they can also have problems with their vitals, meaning their heart rate goes crazy, or it tanks, or or their breathing becomes erratic, or things like that, because they're so uncomfortable and having a hard time. Well, this local hospital had the baby for about 3 days and then discharged the baby, actively withdrawing from methadone, which is not standard protocol. So I was just like, wait, what? And they literally had written a little note saying, baby, last NAS, which are like the withdrawal scores that we use in medicine, and this is the dose of morphine that the child is on, and good luck. And that's just not good medical care, especially, like, and you may not know, because I didn't know, there is one pharmacy in Southern California that will give you liquid morphine or liquid methadone. There is one. And there is a very, very strict protocol, as you can imagine, for obtaining that morphine or methadone if you need. And so I knew nothing about that. And so the NICU back and said, can I speak to this provider who's on the record? And she was like, oh yeah, the baby was fine, so we thought we could discharge. And I was like, but you discharged without morphine, without a plan, without, like, this isn't standard of care. And she's like, oh, okay, well, I'm sure you'll be fine. This is the pharmacy that we used, and good luck, basically. And so it was a mom, and at this point, she thankfully had a good support system. Her mother was very involved, so the baby's grandmother was very involved, and she was at every visit. And the mother wanted to do the right things for her child, but you have a baby who's withdrawing actively, so very irritable, very upset, and you have a mom who's not quite prepared to take care of a baby that sick. You can imagine, this is a mom who is on methadone herself. We say for migraines, but that's not the usual protocol for migraines, so I'm not sure. The dad's not anywhere involved. He showed up like once or twice, kind of, seemingly having some substance issues of himself, not really being able to take care of himself. And these two young people live in the back house of the grandmother. And so I really just relied on the grandmother, and I had to create a protocol. I had to call pharmacies. I had to figure it out. I had to see that baby every few days for weeks. I mean, I was like, if you see anything, and I had to literally train the grandmother, like, these are the signs. Like, if you see anything, we're going to go slow. We're going to try this out. Like, this is the prescription. If you lose this prescription, there is nothing I can do. Like, I'm trying to fax it. I'm trying to give them a paper copy. They have to drive there and specifically show their license and all these things, and then call me and verify just because, again, like, it's not usual for someone to drive up to a pharmacy and ask for morphine for an infant. And I'm giving very small amounts that I'm like titrating, and we're trying to stick in the baby's mouth and just make sure that the baby's okay. And so I formed a very close relationship with this baby and with the grandmother specifically. And we were a team, and we worked together, and she kind of believed in me. She's always a very positive, smiling woman, thank God. And she was willing to do whatever to take care of her granddaughter. And she really trusted me, which was great. And as a brand new pediatrician, I'm trying to go in there confident, like, this is what we're going to do. Here's the plan. But inside, I'm like terrified. Like, I've only ever done this in a hospital. Like, this is supposed to be done with the baby on full monitors, having a nurse do their NAS scores every hour. Like, there's a lot of parameters that go to this. And I'm sending this baby out into the world with a mother who has a really weird story about methadone, and a grandmother who seems very capable. So thank God for this grandmother. And the other thing that was weird was, like, the hospital's like, well, the mother told us she had migraine. They said that the mother said it was methadone for headaches. So why don't you go to the mother's methadone clinic to get methadone for the baby? And I was like, in what world Do I send a newborn to a methadone clinic? Like, this doesn't make any sense at all. So it was just kind of a really crazy story. And the reason I don't, and we just really bonded. Thankfully, this baby weaned really nicely, really well. I mean, there were a few hiccups along the way, but I saw this baby every 2 days, every day, every week, then every other week, then every month until the baby was completely weaned and doing really well. Now she's about 4, and she's great. I actually just saw her, and the reason why this story came up is because Araceli Barker, who's the RN nurse manager for the Valley, was joking. She's like, "Remember that baby? It was such a crazy story, and you were running around like a crazy person trying to get these answers and trying to make sure this baby was okay, and you saw all the time." And it was just funny because it was at the Thanksgiving meal, and I said, "Well, guess who I just saw today?" And I had just seen her in clinic that day. And she was this smiling, happy 4-year-old, totally, developmentally normal, ready to share, ready to give me a big hug. Grandmother was ready to give me a big hug. And through this, I met other, kids in the family, and they've trusted me through other illnesses and things like that. But it was kind of just like it's so funny that she brought it up because she's like, "I remember this crazy story when you started," and I was like, it kind of was full circle because I had just seen the family that day, and I had told the girl how big she'd gotten and how proud I was of her and how great she was doing, and the grandmother. And I checked in on the mom and made sure the mom was okay. And the mom has been, doing okay. She's got a job. She's holding down the job. She's able to pay her mom a little rent. She's, still on methadone, hasn't relapsed, hasn't taken anything else, has completely been in the picture. The father kind of has disappeared from any discussion or any talk of anything, which I only really saw him twice in all of this saga. But it was just a very interesting and kind of crazy story. And so it will always stick in my mind because it challenged me medically, it challenged me emotionally. It was a lot of time and effort. And it really like created a bond with this family that like, this grandmother knows she can call me for anything. We can talk about any of her family members and we'll make it work. And she'll trust me to, do the best for all of her grandkids, which is really nice. I spend a lot of time and people, think it's, so, like you're always like laughing or joking or things about your patients or you're cuddling them or reading to them. And I'm like, because it's about the relationship. And if they trust me, as like, just a person who's a good person, then they'll tend to trust me as a good physician and that we can go forward, with our relationship. So I take that very seriously. And especially with my teens, I do a lot of mental health and teens in crisis. And my teens know I'm there for them. I will tell them they can call the clinic anytime. The clinic will find me. They can reach out to my case manager, Jessica. Jessica will find me at any moment. We will figure it out. Like, you are not alone. And that's what I tell every patient, every teen patient, every day. You are not alone. You may not want to talk to your parent. You may not want to talk to your best friend. You may not want to talk to your sister, your teacher. I don't know, but I'm here. So don't think that you have to manage this crisis by yourself.